You're listening to OET Roleplay Practice with Kev, the English native.
Hello, it's Kevin here with yet another OET Nursing Roleplay. This is based on official card number 4 from OET.com. And let me see, it's the one about, what is it about? It's the one where the nurse goes to home a visit. She's talking to her husband or wife of the patient, and they're talking about what would be the best way to care for this person. Should they go into a home, and all the vocabulary based around that particular topic. So, as always, I've got the transcript link below. You can get it on my learning management system at Notion. So there'll be a transcript there, fully annotated, mapped out to the skills, A, B, C, D, E, empathy, rapport, open questioning, blah, blah, blah. You know the score if you've been listening, listening and reading along to the previous episodes. So have a listen, have a read. I'd appreciate a bit of feedback. Also, you want to leave me some comments. I'm using this AI tool for text to speech. So because I'm trained with OET, I know how it works. So I type a script out based on the roleplay card. I try and make it 5 minutes in total, and I map it out to the criteria, etc. And usually it works out. Everybody seems to be pleased with how they work out. You can use it for pronunciation practice. If you do need some help with that, you can shadow it. You can copy the pronunciation. You can learn the phrases, and more importantly, you can see how it maps out precisely to the clinical communication skills, which is the key thing for you to do. There's an episode on my Kev's English podcast, EnglishNative.com, episode 40, that you may find useful. Link below to that as well. And in that, I talk about responsiveness, the number one reason why people get low scores in OET speaking, a failure to respond correctly to what the patient interlocutor is saying. So, if you want to check out that as well, you can check out this. And I hope you find it useful.
Good morning, Sally. It's nice to see you again. Before we talk about my assessment of your husband, how have you been managing since my last visit?
Honestly, it's been a struggle. I've just gone back to work full time, and trying to balance that with caring for my husband is exhausting. I set up a little fridge and a microwave in the bedroom so he can reach meals, but I still feel it's not enough.
I can hear how much effort you're putting in. Balancing a demanding job and caring for him at home is no small task. From what I've seen today, his mobility has reduced quite a bit, and because he needs oxygen continuously now, he really does need someone nearby most of the time. How does it feel hearing that?
It's scary, to be honest. I knew we'd get here eventually, just not this soon. I'm not sure what to do anymore. Sometimes I feel guilty leaving him alone, even though I know I have no choice.
That's a very natural reaction. You've managed so much for 2 years, and guilt is common in situations like this. But please remember, you've been doing everything you can. Let's look at options that support both of you. How does that sound?
Yes, let's do that. I could really use some advice.
One path is arranging a full-time carer at home. Another is a nursing home where he'd have round-the-clock supervision and clinical support. We can explore both step by step. Before we continue, can I ask, is there any possibility you'd consider giving up work again?
No, there's no way I can give up my job again. We need the money to pay the rent. A nursing home might be a solution, but I don't know if my husband would agree to it.
That's very understandable. Many families face the same dilemma. What do you think your husband's main concern would be about a nursing home?
Probably losing his independence. He's proud and he doesn't like the idea of being looked after.
That's a common worry. The reality is that nursing homes today provide a high level of care while still encouraging independence where possible. Staff are trained to support patients with dignity. How does that sound to you?
Well, I feel a bit better hearing that, but I still don't know how to even start looking for the right place.
That's a valid concern. Here's what I suggest. Start by making a list of requirements for your husband. Things like location, type of room, any special equipment he might need, and visiting hours that fit your work schedule.
Okay, that makes sense.
Then, once you have a short list, you can visit the homes, speak with staff, and even talk to residents and their families. That way, you'll get a real feel for the environment.
Yes, that would help. If you could make some suggestions for care homes, I'll definitely talk it over with my husband.
Absolutely. I'll prepare a list of suitable homes and send it to you later today. We can then arrange another meeting to go through them together. Would you like me to also connect you with a social worker? They can guide you through financial support and emotional resources.
That would be wonderful. I hadn't even thought about that side of things.
You don't have to carry this burden alone. There are people and services designed to support families like yours.
Thank you, nurse. I feel more reassured now. I still don't know how my husband will react, but at least I have a clearer idea of what to do.
That's exactly the goal for today, to give you clarity and options. Once you've spoken with him, we'll take the next step together.
I appreciate that. It's a big relief to know I'm not facing this on my own.
You're doing an incredible job, Sally. I'll send you the information later today and we'll take it from there.
Thank you so much. That really helps.
All right, Sally, let me just summarise what we've talked about today. You've been doing your best to balance work and caring for your husband, but his needs have increased and he now requires round-the-clock support. We discussed two main options: arranging a full-time carer at home or considering a nursing home. You've said giving up work isn't possible and you're open to exploring nursing homes, though you're unsure how your husband will feel. So the next steps are, I'll send you a list of suitable homes, you'll make a note of your husband's requirements, and then you can both visit some places together. I'll also connect you with a social worker for extra support. How does that sound to you?
That sounds clear, nurse. I feel more reassured now and I'll talk it over with him.
Good. You're not alone in this. We'll take it step by step together.
Well, that was quite interesting. I hope you found it so. Like I say, these text-to-speech tools, it's a relatively new venture for me. All my OET students on italki, link below if you want to get in touch. They all appreciate these because they can hear and see exactly how the phrasing matches the criteria. So your clinical communication skills. Anyway, hope that helps. I keep meaning to do more of these, but they are quite time consuming. So this is number 4. I've done 4 for nursing. This is the 4th. I've done 4 for medicine. This is the 4th for nursing. I had a pharmacist last week, and I'm going to try and make that into a role play also this week, and I'll try and do number 5 for medicine, number 5 for nursing. I'm definitely going to try and get at least one each a week, but like I say, it is quite time consuming, and I have many other things. I've got my channel on YouTube, link below, for OET writing. If you need some assistance there, I've got, 100 videos on writing, or 200, I don't know. But there's quite a lot of videos there for OET writing, both medicine and nursing and various others as well. So you might find that useful. So I'll put a link to my YouTube channel. You can check out my videos at OET writing. If you're listening on Spotify, which is the only place where you can listen to it, I think. I might put it on YouTube. I'm not 100% sure. We'll have to see. But so there's the writing stuff for YouTube. I'm trying to mix some audios here. And I also write articles about it on LinkedIn. Again, link below if you want to check it out. Feel free to add me as a contact on LinkedIn if you wish. I don't actually mind. If you need some classes, contact me on italki anytime. Again, link below. So, hope that helps, and I'll see you. I keep saying this. Unless you're my student, I won't see you ever at any time. But you might very well hear me. So, hope these help, and I'll try and do as many as I can. So, bye for now.
Thanks for listening to OET Roleplay Practice with the English Native. Join me next time for more practice and tips.